So thank you very much for being here today within the project of Next Generation Medicine. We're very pleased to have you here today.
Oh, thank you for having me.
With greatest pleasure. So within this project, we've talked quite a lot about women's health, but today we're going to discuss men's health and imaging in particular, prostate cancer in particular, and this is your field of expertise. So until now, in Switzerland, in Europe, in America, MRI has not been used very much in the diagnostic of prostate cancer. We have done a lot of screenings with the PSA, and then usually from there on, you go and do a biopsy. What's the state of the art at the moment, and what's to come in the future in terms of imaging and in terms of biopsies?
Mm-hmm. So it's true, it hasn't been used so frequently in prostate cancer or prostate cancer diagnosis, MRI that is, and that's because we were not good enough yet with our machines, with the interpretation, and we made a technical progress that now allows us to visualize the prostate cancer itself, while before it was only possible to image the prostate, but not the cancer. And so, given that fact that we made progress and that we can now visualize the cancer, it has found its way into the management of a patient with elevated PSA or with clinical suspicion of prostate cancer. So now, if a patient comes, we can image the prostate, we can see where a cancer might be in the prostate, and therefore we can then, or the urologist can therefore then more exact biopsy, do a more exact biopsy, because he knows where the suspicious region is. And this new approach now in Switzerland is state of the art. Here we don't do any biopsy anymore without an MRI before. And I'm sure that we'll even pick up more and more. We feel it here that the prostate MRI exams go up each year, and I think it will even increase more. And what is to come might be that it will find its way into a kind of a prostate cancer screening, but more a combined approach, not only the PSA, because we know about the pros and cons of PSA, but maybe combined with the MR imaging.
I mean, I think that's brilliant because, as you know, prostate cancer is the leading cancer for men in Switzerland. So a lot of men are affected. But as we also know, the PSA screening allows a lot of false positive results as well. So a lot of people undergo biopsies without actually having an indication, or actually not necessarily having to have a biopsy because the PSA was falsely positive, so to speak. So I think that's great when you can combine it, PSA combined with imaging such as MRI. So in terms of diagnostics, I think it's quite clear that there might be a huge benefit. How about therapies, targeted therapies of prostate cancer? What's the role of the imaging in the targeted therapies of prostate cancer?
Well, the role is very crucial because to approach a disease, you have to visualize it, you have to know where it is. Mm-hmm. So for a focal or a targeted treatment like high-intensity focused ultrasound or cryoablation, whatever there is, you need to know where the tumor is. So there is no targeted biopsy without a target. So we provide the target by MRI, by visualizing the tumor. So it's a conditio sine qua non, it's a necessity. Yes. That you see the tumor. Otherwise, you cannot go to a targeted biopsy. However, a targeted treatment. However, the targeted treatment is not for all the cancers. It's for a specific group of cancers where this is a good treatment.
Mm-hmm. So, can you, based on the MRI, differentiate different types of cancers?
We have a way of characterizing the cancer because, as you know, it's especially with prostate cancer, it's very heterogeneous. So there is many different aggressiveness of prostate cancer, and the MRI has the possibility to not to exactly, let's say, grade the cancer in terms of aggressiveness, but if you have two lesions, you are able to show which one might be the more aggressive and which one might be the more benign, let's say. And this also helps to define an index lesion, a lesion that you want to approach.
Sure. So, as we all know, PSI, or the prostate-specific antigen that you detect in the blood, is very much used as screening, but again, we would like to use more also imaging to triangulate the methods, so to speak. What's the role of artificial intelligence in imaging, and particularly in MRI of prostate cancer or potential prostate cancer?
Well, it's a very hyped topic, not only in medicine, everywhere. And in medicine, particularly in radiology, of course, artificial intelligence is interesting because we have images, they have to be processed, the images get more and more, so we need some help. And in prostate cancer imaging, it's quite a complex exam consisting of many different, let's say, sequences that you have to integrate as a radiologist. So artificial intelligence in prostate cancer is not yet as established, let's say, as, for example, in detecting lung nodules, because it's a bit more complex. But we're working also together with the ETH in developing algorithms that help us, first of all, find the prostate. The computer needs to find it in the images, and then also, in a further step, to find the cancer for us, or at least give us some triage in the beginning where to look for. We're not there yet, but it's a very interesting field of research also that interests me personally, and we're doing little steps to so the computer can help us find the cancer.
Are you involved in the project yourself at
Yes.
the ETH?
Mm-hmm.
Super, great. Well, I very much look forward to hearing more about it and the entire process. I hope we can have a follow-up in a few months and see where we stand. Thank you very much indeed for the interview. Thank you very much.
Thank you.